Let's switch gears because this is an important story for all of America. Joining us now, the former White House top official. He's the go-to guy on COVID testing. He's Dr. Brett Jarror. It's great to have you back on. We're switching gears away from the Epstein and Ghislaine Maxwell case. What happened with the breakdown and ramping up tests? I mean, we're heading into year 3. The president's vaccine mandate requires testing. So why no Operation Warp Speed for tests?
Well, thanks for having me on. We actually did have an Operation Warp Speed for tests. That's why we were able to ship out 180 million rapid tests before we left office, with another 60 million on order. What really happened is between January and September, the current administration placed no orders. They did not keep the demand up, so the industry involuted. All the lines that we built got shut down, people were laid off, and thus you're behind the 8 ball now when you really needed the test. Our mantra was make as many tests as possible, as quickly as possible, and the federal government will buy them all. That's what we did, and the Biden administration has failed. That's why we're in the testing problem we are having right now.
Well, the media really blamed the Trump administration for testing failures across the board. And now the same talk is now headed toward the Biden White House. We're going to stay on this story because testing helps with avoiding lockdowns and shutdowns. You need testing in order to open up the economy and keep people healthy. Let's move on to this. The CDC is getting slammed by the media and the left, claiming that the CDC is caving to big business and cutting the quarantine period to 5 days from 10. Because the CDC and even Dr. Fauci was worried about a major worker shortage. This after these guys backed shutdown. So what is your take on that? They're worried about tens of thousands of cops, firefighters, grocery workers getting laid off. What do you say to this?
Well, we worried about that too. Remember, this is not just an exercise in infection control where we lock everyone up. We have to keep society going. We have to keep the economy going. What my problem is that the guidelines that they put out are so confusing, they're hard to understand. And what they clearly needed to do, and it's done in the UK and other places around the world, is after you've been diagnosed with COVID, the idea of being able to get out after 5 days without a rapid test showing you negative is really a bit reckless. And I don't know why they did that. I think I know why they did that is because they don't have any tests. So they're really stuck. But the safest procedure would be to isolate for 5 days and to test yourself to make sure you're negative. The UK, you're isolated for 7 days with 2 negative tests, 6 and 7, before you get out. I think that would be prudent. They won't admit the reason they did it, and that's because they don't have the test to do it safely.
Yeah, there's no indication you need to self-test. I mean, so that's what's interesting. I mean, critics were citing a letter from the Delta Airlines CEO to the CDC director requesting the reduction to 5 days from 10 days quarantine. But then the CDC is saying, wait a second, we're citing scientific data. Most viral transmission occurs 1 to 2 days before the onset of symptoms and then 2 to 3 days after. So let's talk about this. The CNN is saying that the CDC is confusing people. Dr. Fauci is saying, no, we need to protect and keep workers working. Watch.
I think it really encapsulates what many Americans are feeling right now, confused and even a little doubtful and wary after the CDC dramatically shortened its recommended isolation period for the COVID positive just as Omicron is exploding. A move that's also drawing some criticism from many renowned experts on infectious diseases. Could it lead to even more COVID cases? That's a fear.
One of the things we want to be careful of is that we don't have so many people out. I mean, obviously, if you have symptoms, you should not be out. But if you are asymptomatic and you are infected, we want to get people back to the jobs, particularly those with essential jobs, to keep our society running smoothly.
Where was Dr. Fauci saying that last year when it was all about shutdowns and lockdowns and 15 days to slow the spread? Now he's about the economy? Are we supposed to believe that?
So look where we are. The reported cases are over 440,000, but they're underreported by about threefold. So we're having about 1.2 million new cases of COVID in this country every day. I support people to get out of isolation as quickly and as safely as possible. We should do that so we can keep our society together. The issue is because of a lack of forethought, because they did not keep the industry open, because we do not have the testing available, they did not keep the momentum that the Trump administration began. We do not have the test to do it safely. If you're infected, there is really every reason to believe that you need to test to get out at day 5 or 6 or 7. What they've said is just at day 5, put a mask on and go out. I don't think that's a safe way to proceed, but they're stuck because of a lack of planning and just, chaos in the administration.
Here's the thing. The other thing is about herd immunity, right? I mean, we've got studies coming in that the Omicron variant could create herd immunity, and that Omicron, the variant, could protect you from reinfection by the Delta variant. Those studies coming out of South Africa. Where do you come down on that?
I think that's probably true. Natural immunity is very strong, and hybrid immunity, meaning if you've been vaccinated and then gotten the infection or vice versa, is extremely strong. I think what you're going to see is Omicron is generally a very mild infection, unless you're on the edges where you're at very high risk. People will get this mild infection. I know 20 or 30 people who are triple vaccinated and now have Omicron, but they have like one day of sniffles and it's over. That will yield potent, powerful immunity. It's better than any booster that anyone will get. I don't advise you to get sick on purpose, but if you do get Omicron, that is going to have long-lasting effects for our herd immunity. And I think we're seeing the light at the end of the tunnel of the pandemic.
Interesting, because Dr. Martin Makary is saying, this is so-called nature's vaccine. We don't know yet. We're at the early stages of it, but we could be on the cusp of it. I mean, you're right. Omicron, UK, US studies, South Africa studies, cuts hospitalization rates. If you have Omicron, you're 70 to 80% less likely to be hospitalized. Do we have time to show this police officer in Boston who's upset with what is going on with vaccine mandates there? Let's listen to this police officer. Watch this.
Mayor, when you were pregnant, did you drink drugs? Did you do drugs or drink alcohol? No. Did you eat sushi or cold cuts? Did you listen to your doctor, your husband's wishes, and the guidance of your faith leaders? Mayor, did you make your own decisions for yourself and for your unborn children? Did you do everything you needed to do to have a safe and healthy pregnancy? Do you right now can put your faith, your person, everything that your research behind this vaccine right now, and sign a document for us saying that you personally and the city will take full responsibility if something was to happen to us as mothers and our unborn children? Would you do that right now for all of us?
She's about to lose her job January 5th. She doesn't want to take the vaccine because she's pregnant. Your final word.
My final word is both my parents were police officers, and it absolutely pains me and it's tragic that the Biden administration has so villainized people who make reasonable choices. And again, I'm not saying it's a choice I would make, but it's a choice she has to make for herself and her unborn child. And it's just tragic that we villainized her. We need to work with her and support our first responders.
Got it. Dr. Brett Jarror, it's great to have you back on. Come back again soon. It's good to see you.